10 years ago, President Obama signed into law the greatest expansion of health coverage in over 40 years. Since then, the Affordable Care Act, or ACA, also known as ObamaCare, has had quite the journey. Here's the wild story of how the ACA became law, reached implementation, and everything it's accomplished over the last 10 years. Let's go back to where it all began. It's 2009. iPhones are a new phenomenon. Jersey Shore has just premiered. And it's the first year of President Barack Obama's presidency. The country is in the midst of the Great Recession, and 1 in 3 young adults are uninsured. President Obama quickly looks to pursue one of his key campaign promises, major healthcare reform. Despite having unified Democratic control of the White House and Congress, there are no guarantees a bill can muster enough support to pass both chambers. The House and Senate present their own versions of major healthcare reform, and battle over reconciling their differences begins. On November 7, 2009, the House just barely passed its version of the bill. Now it was up to the Senate. After much drama and a last-minute deal known as the Cornhusker Kickback, the Senate voted 60-39, filibuster-proof by 1 vote on Christmas Eve 2009. Not one Republican in either chamber voted for their respective bills. Hammering out differences, the Senate version prevailed and the House voted again to okay the amended Senate bill on March 21, 2010. 2 days later, on March 23rd, President Obama signed the Patient Protection and Affordable Care Act into law. While this was a day nearly 100 years in the making, the battle for the ACA wasn't over. Almost immediately after the ACA was signed into law, opponents brought forth a lawsuit challenging the constitutionality of the individual mandate. That's the part of the law that says everyone must now have health insurance or pay a fine, as well as the law's expansion of Medicaid. This first court challenge reached the Supreme Court in 2012, 2 years before the ACA was set to go into full implementation. That June, the Supreme Court issued their decision, upholding the individual mandate, but also allowing Medicaid expansion to be optional. While the ACA survived, we now have a patchwork of 37 states, including DC, who have expanded their Medicaid programs to cover millions of low-income people, and 14 states that have not, creating a coverage gap for millions more that the ACA was intended to help. Fast forward a few months to November 2012, Election Day. Governor Mitt Romney ran on a platform of repealing the ACA, and had he won, the ACA may never have become a reality. However, President Obama wins his re-election bid and all but ensures the ACA will reach its full implementation. Still, there was much to do in preparation of full implementation. 2 of the law's signature provisions were an expansion of coverage through Medicaid and a new, better regulated individual market that offered subsidized coverage to people based on their income. The new health insurance marketplace was to roll out January 1st, 2014. As advocates and organizers geared up for the start of open enrollment in October, disaster struck. The new website meant to handle enrollment, healthcare.gov, launched with severe glitches, preventing anyone from being able to complete enrollment through the website. In crisis mode, the Obama administration hired new tech experts to work around the clock to resolve the issues. It took nearly 3 months, but finally, healthcare.gov was fixed and millions of people could get enrolled. From community health centers to stadium enrollment events, people lined up for help signing up. The impact of the ACA and the opportunity it created was clear. Millions of people could now access the healthcare they needed, some for the first time in their lives. Not a year later, in 2015, the ACA landed back at the Supreme Court. A case known as King v. Burwell challenged the validity of the ACA's tax credits, the financial help for low and middle income marketplace shoppers. Today, 9 in 10 marketplace enrollees receive these tax credits. If they were to go away, millions of people would no longer be able to afford their plans. Fortunately, the ACA prevailed. The court once again ruled in favor of the ACA. Moving into 2016, the ACA appeared to be here to stay, but not for long. President Donald Trump, who had campaigned on repealing the Affordable Care Act, beat Hillary Clinton in the 2016 election. Republicans now controlled both the White House and Congress and had the power to strike down the ACA once and for all. Throughout 2017, Republicans in Congress battled over various replacement plans, eventually pushing one bill through the House. The Senate then took a shot at repeal, offering plans from a full repeal to skinny repeal, which would only strip parts of the law without any replacement plan. In a now famous late-night decision on the Senate floor, Senator John McCain of Arizona voted against repeal, giving a thumbs down for all to see. This move effectively ended the legislative repeal and replace effort. The Democrats took back the House in the 2018 midterm elections, officially denying any chance that a repeal bill would get through the 116th Congress.
So why has the Affordable Care Act remained so resilient? Despite the near endless attacks, serious court challenges, and attempts to undermine the law at every turn, the Affordable Care Act has survived. Thanks to the ACA, 20 million Americans have gained health coverage. The states that have expanded Medicaid not only have much lower uninsured rates, they also have lower costs and better health outcomes for their residents. The ACA created key consumer protections that have kept millions from filing for bankruptcy due to medical debt and has made sure insurance covers services that people need. Take, for example, maternity coverage. Did you know that before the ACA, a woman in her 30s who tried to buy individual coverage would almost universally be denied maternity care? Now, all plans that are sold on healthcare.gov must cover maternity coverage, as well as mental health care services and prescription drugs, just to name a few key benefits that were previously excluded. For young people, the ACA has been a total game changer. Young people no longer have to fear losing coverage when they reach adulthood. They can stay on their parents' plan until the age of 26. And for millions who don't have that option, Medicaid in the marketplace is there for young people finishing school, taking care of their families, or working part-time. Student health plans have also been strengthened thanks in large part to the ACA. All of this has led to the uninsured rate for young adults being cut in half from 29% in 2010 to 14% today. Now let's talk about mental health care for a bit. Mental health is the number one reason young people seek out health care. That's not surprising when you look at the stats. Rates for anxiety and depression have skyrocketed among young people, and suicide is the second leading cause of death among college students. While there's still a long way to go, making mental health an essential health benefit makes it much easier for millions of young people to get the care that they need. While the ACA has proven resilient, we must continue to fight to protect it. As the ACA celebrates its 10th birthday, there's yet another lawsuit headed to the Supreme Court that seeks to strike down the entire law. If this next case is successful, millions would lose their health coverage. People could once again be denied benefits based on their health status, and none of us would be guaranteed protection from annual and lifetime limits that could bankrupt a person. So, if this sounds like a love letter to the Affordable Care Act, that's because it is. I've had many friends and family members with serious pre-existing conditions that would have been denied coverage without the ACA. So, as you know, many Americans have already been impacted and touched by the Affordable Care Act, even if they didn't realize it. We hope you enjoyed this wild ride that has been the last 10 years of the Affordable Care Act. And we hope it reminds you how important this law is to millions of Americans. Please share this video, and if you feel so inclined, call your state attorney general's office and ask them if they're supporting or if they're opposing this latest lawsuit. It's about time we move forward and build on the progress the ACA has made. Happy birthday, ObamaCare.